levels. Did these participants reach our goals? This was a great indication to us that this plan was actually highly feasible.
We'll see like some really, really big changes in GFR over 12 weeks, as much as like 20 plus points.
Some people come in, they want to lose weight. Some people come in and they don't want to lose weight. Well, I have some good news about that. We showed overall huge improvements by participants. As someone who doesn't like to take medications, this is so valuable.
Hello, everyone. My name is Jessianna Saville. I am one of the renal dietitians at Kidney Nutrition Institute and the Rise for Nutrition for PKD program. And I'm here with Kelly Welsh, our program coordinator at the Rise program. She has been coordinating the program now for 3 years.
2 years.
2 years. And she also ran she was a participant in the program in the very first beta test of it as well. And today we're really excited to be here to just share a little bit about the poster that was presented at the American Society for Nephrology conference. There's two like significant conferences in the kidney world, a National Kidney Foundation and this one, ASN conference. And so it's really an honor to be able to share some of our results from the work we've been doing for the last several years on the RISE program. Now, in this poster, it talks about the Renew program. That is the RISE program, which was formerly branded Renew. And at the time that this poster went to publication, we had not rebranded at that point. So I was going to talk about the Renew program, which is actually RISE. The Renew program is was a collaboration between Kidney Nutrition Institute, Santa Barbara Nutrients, and it's the same program we run today at Kidney Nutrition Institute. It's ketogenic, low-oxalate, supported by specialized dietitians. It's also a group program where people come in for learning every week. And many of the participants choose to take KetoCitra, which is a BHB product produced by Santa Barbara Nutrients in the program as well. So that's kind of the overview of what's going on here. 12-week program that people go through to learn a ketogenic diet. So I'm going to have Kelly to share a few of the results from this program, what we published about on the poster, and then we'll just give you a little bit of inside commentary on what you don't see on a poster from the work of actually working with the participants. And that's what we're going to go through.
Great. Great. Thanks, Jess. So I think before we get started, it's important to remember that this is not a formal clinical trial, but a baseline controlled assessment of this real life dietary program that we do here. So first of all, let's give some of the basics. To date, we have had over 200 participants go through our program. The data from this poster that we're talking about today is from patients who started in 2021 up till 2024. And honestly, I have to say, Jess, it's really great to see all of this data in one place because we as dietitians, we know what we see every day, but to see it in one place is quite amazing. So, of course, as with, we're dealing with humans, so outside factors cannot be controlled by us 100%. The participants that we had data from that we were actually able to evaluate was about 103 patients. So that's important to keep in mind going forward. So some statistics that are important to know: the average age of these participants that we analyzed the data was about 50 years of age. And 53% of this data from these participants, these patients started with a CKD somewhere between 30 to 59. So in CKD stage 3. Now, one of the most important things I know people I thought about when I went through the program is, what's the feasibility of this? Am I going to be able to do this? And we analyzed the data using the average ketone levels. Did these participants reach our goals, which would indicate, sure, they can do this. So interesting enough, during the fat adaptation phase, where we're training your body to prefer ketosis, and just by the way, as a side note, this can last somewhere between 4 to 8 weeks, really, really, really varies by person, but we keep our ketone targets somewhere between 1 and 2. Now, as you become fat adapted, goals are going to shift a little bit. And then we shoot for a little bit lower level of nutritional ketosis at 0.5 or higher. Now, the results of this were great to see because average ketone levels throughout the program were approximately 1.0. This was a great indication to us that this plan was actually highly feasible. So great to hear on that. Body weight loss. I know a lot of people talk about body weight loss, and there's two different camps for that, right? Some people come in, they want to lose weight. Some people come in and they don't want to lose weight. Well, I have some good news about that. So to start the program, approximately 50% of participants were overweight or obese as classified by body mass index, right? Those participants lost the most weight during those 12 weeks because, of course, they have more fat to lose. The weight loss overall averaged approximately 4.5%. Now, on the flip side of that, it's important to note that no one became underweight. So we didn't see levels below a BMI of 18, which sometimes can be a misconception with this type of program. So that's really, really, really good to see. Now,
Yeah, we do have a lot of people that come in. We have some people that come in, they're like, I want to lose weight. We have a lot of people that come in and say, I'm already super lean, like I want to do
yep,
ketosis, but I do not want to lose weight. And that's
right.
been a really interesting dynamic.
Right. And most importantly, muscle weight. A
Yeah.
lot of our patients that come in are training, they're doing really intense activities. So they're afraid they're going to lose the weight, and that weight loss is going to be from muscle. So really, really, really great to see. Now, what everyone always asks about, right? What's the GFR? What did the eGFR say during this program? So it's important to note that at the RISE program, we really, really closely monitor you, and we are taking labs at minimum before and after the program. Now, if your dietitian notices something that she wants to check throughout the program, that is absolutely done. But back to the eGFR, what everybody wants to know is, did it improve? And the good news is that yes, the improvement was statistically significant. And to give you some numbers here, the average increase in eGFR was 6.3%. Now, Jess, you want to make some comments on that for us?
Yeah, so there's the real life picture here also. So one thing we want to acknowledge when we're looking at GFR, that's such a big number for people to hang their hat on, right? Like so many decisions feel like they're driven by GFR. With polycystic kidney disease, of course, we know that GFR is not always reflective of cyst growth. The gold standard is having an MRI. The reason this is still important to us to still be following and monitoring GFR is because to us, having worked with, hundreds of people at this point, the story that we hear consistently over and over and over again is, for my whole life with PKD, I have been on a decline of GFR. It's either been like stable and then you start the downward decline. And then after that, it doesn't kind of stop, right? Um, and so for people to have an improvement in GFR after having a lifelong experience of a decrease, for us, we don't think that's something that we can just brush aside and just say, oh, well, we don't know if ketosis actually works because we don't have MRI data on actual cyst growth. For us, that's still a significant marker, whether it is because cysts are actually improving and shrinking, or because overall health and inflammation has reduced. To me, either one of those, you are preserving kidney tissue and you are extending the life of the kidney. And so we still feel like GFR is an important number to think about and look at. It's very important for our participants also psychologically, just to say, hey, I am putting forth a lot of effort, and does it make a difference? It's making a difference to me. And we see that a lot. And, we'll see like some really, really big changes in GFR over 12 weeks, as much as like 20 plus points. That's not typical, but we see them. That's not, shown in this poster specifically. We have some people that they stay really on that average, right? Maybe 5, 10 points, and some people would dismiss that, but you can't dismiss it. If you've always had a trend down and to start seeing a trend up, you just can't dismiss that data.
Yeah. Love that. Thanks, Jessa. Yeah, I agree. I think it's important to remember that, this is an average of a
Yeah.
6.3% change. This isn't everybody, and there's no way we can guarantee what will happen to you, right? So
Yeah.
we see less, we see more. This was the average. So
Yeah.
good points, good points. Okay, another measure that we analyzed was pain reduction, and this one's a little bit more subjective. So we assessed pain, and when I say pain, I'm mostly referring to kidney pain that people have, that PKD patients, a lot of us can relate to. I'm also referring to headache levels, migraines, everyday headaches, but these pain and headache levels were assessed by self-assessment from the participant using a 10-point scale. So 0, no pain, 10, a lot of pain. Throughout the program, because they're analyzing their pain in the beginning and at the end. We showed overall huge improvements by participants. Some even went down to 0, which, as you know, as if you're a PKD patient, quality of life and this kind of pain in your everyday life can be debilitating. So great, great improvements and results there. Now,
And one thing that's really interesting about, I just want to comment on this
yeah,
pain data. So if you
yeah.
look in the keto world outside of PKD, ketosis is used as a pain management tool anyways, because it does interact with nerves. So we don't know if that pain reduction is just ketosis. We don't know if it's when you see this reduction in oxalates, because
Mhm.
I have seen definitely patients, we've just reduced oxalates and we see some pretty big pain improvements. Maybe it's reduction in inflammation overall. So there could be a lot of things that are playing into it. Whatever the reason is, which I think we'll, continue to learn over time, it is such a massive quality of life improvement. When we started this program, this wasn't something we were even thinking about, or it was not on our radar with like, oh, this will really help people a lot. But then we started consistently, as each cohort went through, seeing patients comment like, wow, my pain improved so much. Like, oh, my flank pain is not as bad, or headaches or whatever. And we realized that the nutrition changes they were making were really, really impacting their quality of life just on a pain standpoint. And so this is something we have talked a little bit more about.
Yeah, it is quite amazing. And you hear many patients, verbally tell us how much their overall quality of life has been with the pain decrease, activities that they weren't able to, participate in before, or things are easier. So really, really great part of the program. Okay, let's talk about blood pressure, because this was exciting. And this is something, Jess, I think you'd agree that we see fairly frequently.
Pretty
But the
consistently. Yeah.
results from this group, as far as hypertension, blood pressure goes, is about half of the participants that we evaluated had a decrease in their blood pressure and actually were able to decrease blood pressure meds or even stop medications. As a PKD patient, as someone who doesn't like to take medications, this is so valuable. And I think we hear that all the time. Like, it becomes a goal of patients that we see a lot of times to, let's keep an eye on the blood pressure. I want to try stopping or decreasing the med if I can. So this is always a fun one to watch participants experience.
And it's so significant, in fact, that we built into like our protocol in the first week to make sure we have given patients a heads up. Like we talk
Yep.
about it in the session, in the email, in like all the program components that go out the first week. We give them
Mhm.
a heads up, like, hey, in the next like 6 weeks or so, you may not feel good, but it's not because the diet isn't working, it's because your blood pressure is too low.
Right.
So you need to be monitoring it. The first program, we didn't have people necessarily get blood pressure cuffs, but now we really strongly encourage it because it happens so very much.
Right. 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 Exactly. That's what I have, Jess, on the poster.
Awesome. Yeah, this is a great privilege to be able to get this poster out and share some of the data. A lot of people are asking, what kind of results do you actually get in the RISE program. And so we're happy to be able to share this. We will put a link to the abstract from the American Society of Nephrology website below. And of course, if you have any questions, let us know. Also put a link if you want to come into one of our upcoming cohorts. You can pop on the website, you can talk to me or Kelly or Amy, one of the dietitians, if you need a little bit more information about the program before enrolling. Or you can go ahead and just save your spot in one of the upcoming cohorts and get ready to use it to see those same benefits for yourself. But anyways, thanks so much, Kelly, for sharing that data.
Thanks, Jess.
Okay, bye-bye.
Bye.